Hey there, Amy with Momentum Physical Therapy, and I wanted to tell you a little bit about a blog post that we recently released. And we're doing a series related to sleep over the next few months. We started it this quarter, first quarter of 2019. And the reason why I'm interested in sleep is because sleep is critical to overall health. It's integral to a lot of different systems that we'll start going into. This blog post, we talk about specifically sleep and pain and how those two things are interrelated. So there are studies now that are demonstrating that if you're not getting quality sleep, so we mean restorative, restful sleep, that in of itself can increase the amount of pain you're feeling in future days. So our ability to deal with pain, our response to pain is heightened, and our ability to deal and function with discomfort and pain is lessened if we have less sleep. And why that's really interesting and also challenging is that it becomes more difficult to sleep when you have physical pain, right? Like if you have back pain or ankle pain or knee pain, whatever it might be. It's more difficult to fall asleep because you have pain, or you might be waking up at night because of the pain, and thus you're not getting as much sleep. And if you're not getting as much sleep, then you might be experiencing more pain in the future, and it becomes this challenging downward spiral. Add into that stress, right? So stress also affects sleep, typically negatively. And the interesting component of this is that that pain in and of itself is a stressor. Okay, so we have stress that negatively affects sleep. We have pain that negatively affects sleep. It can be difficult to get sleep because of stress and pain. And we end up with this really challenging kind of perfect storm that makes it really difficult to move forward. So that's what I'm discussing in this blog post. It's fascinating. It's one of the first things that I start asking patients about or working on establishing more helpful and beneficial sleep patterns if someone's coming to me and they're in discomfort or pain, because if you're not getting good sleep, it can be really difficult to make progress in any other area. So sleep is kind of the foundational thing that one of the foundational things that we start working on. So in the blog post, I just go into a little more detail about sleep, about pain, about what it is, how that's affected with stress, and then also something called the HPA axis, which is discussed in more detail in the blog post. So hope you check it out, and if you have questions, please comment below. And we will just thank you so much for taking the time to read this, and look forward to talking to you soon. If you have any questions specifically about sleep or physical pain with sleep, or just physical pain in general, my contact information is also listed in the comments below. So hope you're having a great day, and I look forward to talking to you soon. Thanks.